Greetings from the Philippines. I am Abner Manlapas, President of Life Haven Center for Independent Living, located in Valenzuela, Metro Manila. Since March, the Philippines are under quarantine, starting with very strict guidelines and gradually loosening the guidelines to open the economy. People's livelihood was very much affected because of this measure to control the spread of COVID-19 virus. The situation amongst persons with disabilities and their families are much worse because of disability-related needs. 2 weeks after the start of quarantine, Life Haven and other organizations of persons with disabilities collaborated with Center for Disaster Preparedness to conduct the online survey to know the situation of persons with disabilities and their families. The survey has more than 4,200 respondents, composed of more than 23,000 household members. According to the survey, 3 out of 5 households did not receive support from their local government. On top of the basic needs, the respondents reported problems with their disability-related needs. According to this survey, 4 out of 5 said they need financial assistance. Over half needs to access healthcare and rehabilitation services. 2 out of 5 needs medicine. About 1 out of 5 needs assistive products and have problems with transportations. After the implementation of the social assistance to the poor population whose livelihood was affected by the quarantine measures, another survey was conducted. The Philippine Coalition on UNCRPD wanted to monitor whether persons with disabilities received financial assistance through the Social Amelioration Program. Over 90% of 1,300 respondents, composed of 1,800 identified persons with disabilities, reported that they have not yet received the financial assistance. We appreciate the government's issued a memorandum directing all local government to ensure that all persons with disabilities receive adequate food packs, medicines and vitamins, and have access to transportation services. However, not all local government was aware of such memorandum. Worse, persons with disabilities are also not aware of such directives. This resulted to persons with disabilities becoming victims of violence when they complained for not receiving the food packs. Persons with psychosocial disabilities are highly vulnerable to aggressive attitude of police due to lack of awareness about disability. In fact, one of the many controversial cases involves a former military personnel who was shot dead by police forces. Others are forced to walk several kilometers from their home to the healthcare service providers. There are also cases that young adults with intellectual disability were rejected to be admitted to hospitals. Another incident is a child with significant disability who had pre-COVID-19 pulmonary condition and was not allowed to be cared by her mother, both resulting to their death. So many stories to tell that I do not have to say anymore because I think it is all the same everywhere around the world when COVID-19 responses is not disability inclusive. Life Haven is working with different networks of organizations of persons with disabilities and mainstream civil society alike to improve disability inclusion in the COVID-19 responses. Life Haven has taken lead to developing policy recommendations such as provision of disability support allowance and improved accessibility of COVID-19 responses. In particular, to recognize the role of personal assistance or carer, as well as ensuring accessibility such as access to sign language interpreters, among other things. We all know that accessibility is a precondition to inclusion of persons with disabilities, so we all must take it seriously. Having the disability support allowance will cover the basic living costs, especially that livelihood of many persons with disabilities are very much affected. To some extent, disability-related needs of persons with disabilities can also be covered by the allowance. One important aspect of good social protection system is the ability of the government to provide faster social assistance to vulnerable people, which was clearly seen during this COVID-19 crisis. We call for all the governments around the world that they have to listen to the voices of persons with disabilities so that we stop the marginalization and exclusion of persons with disabilities, so that we can prevent death and poverty amongst persons with disabilities.